Obesity, smoking, and stress are a few things that can lead to heart disease. Discover how simple changes in your daily habits can keep your heart healthy. Heart disease is a term used to describe conditions that can affect the heart and/or its valves, vessels, structure, electrical system, or coronary arteries. Though each disease affects the heart differently, the ultimate problem with all varieties of heart disease is that they can disrupt the vital pumping action of the heart. Heart disease is the leading cause of death in the United States for all genders. Creating a heart-healthy approach to life may be one of the best investments you can make in your future. And keeping your heart healthy is important as you age. Here's some ways to tell if your heart is healthy, now and in the future. Heart rate. For most adults, the normal resting heart rate is between 60 and 100 beats per minute. Factors like stress, anxiety, medication, and how physically active you are can affect your heart rate. You can tell how fast your heart beats by feeling your pulse. Your heart rate is the number of times your heart beats in 1 minute. Ask your healthcare professional what your resting heart rate should be. Lower can be better, as long as it remains above 60. It may mean your heart muscle is in good condition and doesn't have to work as hard to maintain a steady beat. Breathing. If you're able to perform moderate-intensity physical activity, such as brisk walking, without chest pain or tightness or difficulty breathing, it may mean that your cardiovascular system is supplying your body with the oxygen it needs. By shortness of breath means breathing hard while pushing yourself during exercise. If you feel like your breathing makes you stop doing something, like you're gasping for air and can't catch your breath, that's an indication something might be wrong. Shortness of breath while lying down may also indicate a cardiac issue. Energy levels. Another sign of heart health is having good energy levels throughout the day. If you have a tired feeling all the time and difficulty with everyday activities, such as shopping, climbing stairs, carrying groceries or walking, you may be experiencing fatigue. This could be a sign of heart disease such as heart failure. Your heart might not be pumping enough blood to meet your body's needs. Snoring at night or daytime fatigue could be signs of sleep apnea, which can increase the risk of high blood pressure and atrial fibrillation, an abnormal heart rhythm. Not getting enough sleep, sleeping poorly, and sleep disorders have been linked to a higher risk for heart disease as well as to several major heart disease risk factors, such as obesity, type 2 diabetes and high blood pressure, according to a 2016 scientific statement from the American Heart Association. Recent study findings also suggest that people who got less than 6 hours of sleep had a 25% greater risk of having poor cardiovascular health, while those with obstructive sleep apnea experienced a more than 200% greater chance of poor heart health than those who slept longer. Blood pressure. Having normal blood pressure is a sign of a healthy heart. Normal blood pressure is below 120/80ths of a millimeter Hg. High blood pressure is a systolic pressure of 130 or higher, or diastolic pressure of 90 or higher, that stays high over time. The only way to find out if you have high blood pressure is to have your blood pressure measured. Take measurements on a regular basis because high blood pressure increases the risk for heart attack and stroke, and often has no symptoms. Oral health. Good oral health may also indicate a healthy heart. Recent studies found patients with healthier gums have lower blood pressure, and people with healthier gums responded better to blood pressure-lowering medications. A 2021 study found adults with severe gum disease may be more likely to have high blood pressure, independent of common cardiovascular risk factors. Another study suggested that people who said they brushed less than twice a day for less than 2 minutes had a threefold increased risk of having or dying from a heart attack, heart failure, or stroke. Don't skip regular screenings. Maintaining regular visits with a primary care physician or a cardiologist is key to monitoring heart health and detecting any problems early. Be proactive about your heart health.